Swollen ankles after 60 are not always a sign that your heart is failing. And that sentence matters because too many people see puffiness around the ankles, panic, and immediately assume the worst. But here's the truth most people are never taught. In many older adults, the swelling you see at the ankle is not where the real problem begins. The ankle is simply the lowest point where the body finally reveals a drainage problem that has been building quietly all day. And one of the most overlooked systems in this story is not the heart, it is your lymphatic system. Now listen carefully, because this is important. Swollen ankles can sometimes be a warning sign of heart failure, kidney problems, liver disease, blood clots, infection, or medication side effects. So if your swelling is sudden, painful, mostly on one side, comes with chest pain, shortness of breath, dizziness, coughing blood, fever, redness, or trouble breathing when lying flat, that is not something to stretch away at home. That needs medical attention. But once the dangerous causes are ruled out, millions of people over 60 are left with the same frustrating pattern. Their ankles look normal in the morning. Then by late afternoon, their socks leave deep marks. Their shoes feel tighter. The skin around the ankle looks puffy, heavy, or shiny. And when they press a finger into the swollen area, a little dent may stay there for a moment. That is not just getting older, that is fluid traffic. Your body is supposed to move fluid constantly. Blood brings oxygen and nutrients into tissues. Tiny blood vessels allow fluid to move out into the spaces around your cells. Then that fluid has to be picked back up again. Some returns through the veins, some is collected by the lymphatic system, which acts like the body's drainage and cleanup network. Think of your lymph system as the quiet sanitation crew of the body. It collects extra fluid, waste products, inflammatory chemicals, immune cells, proteins, and debris from tissues, then moves that fluid back toward the bloodstream. But unlike your blood circulation, lymph does not have a powerful central pump like the heart. That is the key. Your heart beats whether you think about it or not, but lymph flow depends heavily on movement, muscle contraction, breathing pressure, posture, and gentle squeezing from surrounding tissues. So when you sit for hours, when your calf muscles get weaker, when your ankles barely move, when you breathe shallowly, when inflammation makes tissues more congested, the drainage system slows down. And where does the extra fluid go? Down, to the feet, to the ankles, to the lowest point of the body. This becomes much more important after 60 because several things change at the same time. Muscles naturally lose strength unless you train them. Veins may become less elastic. Valves in the leg veins may not close as tightly as they once did. People often sit longer. They may walk less. They may take medications that encourage swelling. And the tissues themselves may become more inflamed and less efficient at moving fluid. So the ankle becomes the place where several aging systems meet. Weaker calf pump, slower lymph movement, gravity, more sitting, more inflammation, more medication effects, and sometimes more salt than the body can comfortably handle. This is why one person can have perfectly normal-looking ankles at breakfast and swollen ankles after dinner. The problem was not created in the ankle. The ankle is just where the traffic jam becomes visible. But here is where most people make the mistake. They think drainage means massage. They think they need to rub the swollen ankle harder, squeeze the fluid out, or buy the tightest compression socks they can find. That is not how this should work. The lymph system sits close to the skin and responds to gentle movement, gentle pressure, and rhythmic muscle activity. Deep aggressive rubbing can irritate tissues, especially if the skin is fragile, inflamed, or prone to bruising. And compression can be helpful for some people, but it is not automatically safe for everyone. If you have poor circulation in the legs, diabetes with nerve damage, wounds, numbness, severe pain, or known artery disease, compression should be discussed with a clinician first. So before you think stronger, think smarter. Because the best daily habit for mild ankle fluid is not force, it is rhythm. The body loves rhythm. The heart beats in rhythm. The lungs expand in rhythm. The intestines move in rhythm. And lymph also responds to rhythm. Breathing, flexing, releasing, pumping, lifting, lowering. The habit I want you to understand takes only about 5 minutes. And the reason it works is not magic. It works because it turns your natural drainage pumps back on. First, sit upright in a comfortable chair with both feet flat on the floor. Do not slouch backward. You want your ribs, belly, hips, and legs in a position where pressure can move naturally through the body. Place one hand lightly over your lower belly. Now breathe in slowly through your nose for about 4 seconds, letting the belly expand gently. Then exhale slowly for about 6 seconds, letting the belly soften. Do this for 1 full minute. This may sound too simple, but deep breathing is one of the most overlooked lymph habits in the body. When your diaphragm moves, that large breathing muscle under your ribs creates pressure changes through the chest and abdomen. Those pressure changes help encourage fluid movement from the lower body back toward the center. Shallow breathing keeps everything tight and still. Deep breathing creates a gentle internal wave. After 60, many people breathe high in the chest without realizing it. Stress, pain, poor posture, and long hours of sitting all make the breath shorter. And when the breath gets smaller, the internal pump gets weaker. So the first minute is not relaxation only, it is drainage preparation. You are telling the body, open the pathway. Now keep sitting tall and begin heel-toe pumps. Keep your heels on the floor and lift your toes up toward your shins. Then place the toes down and lift your heels. Toes up, heels up, toes up, heels up. Move smoothly, not aggressively. Do this for about 90 seconds. This is where the calf muscle starts acting like what many doctors call the second heart of the lower body. Every time the calf contracts, it squeezes veins and lymph vessels. Every time it relaxes, those vessels refill. Tiny one-way valves help direct fluid upward, against gravity. This matters because fluid does not climb out of the ankles by wishful thinking. It needs pressure. It needs motion. It needs the muscles of the lower leg to squeeze and release. If you have been sitting for 2 or 3 hours, your lower legs have been almost silent. The fluid has been settling downward, but the pump has not been doing much to bring it back up. Heel-toe pumping wakes that system up without needing a gym, a treadmill, or even standing. Now move into ankle circles. Lift one foot slightly off the floor if you can do so comfortably, or keep the heel lightly touching the ground and circle the ankle. Make slow circles in one direction, then reverse, then do the other foot. Take about 1 minute. The ankle joint is not just a hinge. It is surrounded by small muscles, tendons, connective tissue, blood vessels, and lymph channels. When the ankle barely moves, the tissues around it become like a sponge that never gets squeezed. Movement squeezes the sponge, and that gentle squeeze helps fluid shift. People often underestimate this because ankle circles feel too easy. But for a swollen ankle, small controlled movement repeated consistently can be more useful than one intense burst of exercise followed by 8 hours of sitting. And this is where consistency matters more than intensity. You are not trying to punish your legs. You are trying to remind them how to drain. Now place both feet back down and begin seated marching. Lift one knee a few inches, set it down, then lift the other knee. Keep breathing. Keep the movement controlled. If lifting the knee is uncomfortable, simply tighten one thigh and calf. Release, then tighten the other side. Do this for 1 minute. This brings larger muscles into the process. The thigh, hip, and calf muscles all contribute to moving fluid. And when those muscles contract, they help move both venous blood and lymph upward. This is especially important for people who say, my swelling is worse after sitting. Of course it is. Sitting folds the hips, slows the calf pump, reduces ankle movement, and lets gravity pull fluid downward. The body was designed for frequent motion. Not necessarily hard exercise, but frequent motion. A short walk helps. Standing up helps. Ankle pumps help. Marching in a chair helps. The body does not need perfection. It needs interruption. Interrupt the sitting, and you interrupt the pooling. Now for the final minute, elevate your legs if you can. You can place your feet on a footstool, a pillow, or a recliner support. Keep the knees comfortable. Keep breathing slowly. Do not lock the legs stiff. Let the ankles soften. This is not just resting. This is using gravity in the opposite direction. All day, gravity has been pulling fluid down. Elevation gives the body a chance to return fluid upward with less resistance. Combine that with slow breathing and a few gentle ankle pumps, and you have a simple drainage routine that makes biological sense. 1 minute of breathing, 90 seconds of heel-toe pumps, 1 minute of ankle circles, 1 minute of seated marching, then 30 to 60 seconds of elevation and slow breathing. That is the 5-minute habit. And the best time to do it is not only when the swelling is already severe, the best time is before the fluid has had a chance to fully pool. Do it in the morning to wake up the pump. Do it after long sitting. Do it during travel. Do it in the late afternoon before your shoes start feeling tight. And if you sit for long periods, do a mini version every 30 to 60 minutes. 10 ankle pumps, 3 slow breaths. Stand up for a moment if you can. That tiny interruption can matter more than people think, but that is only part of the story. Because if swollen ankles keep returning, you also have to ask what is overloading the system in the first place. One common reason is venous insufficiency, where the veins in the legs have trouble moving blood back upward. The valves inside the veins may become weaker, so blood pools lower in the legs. When pressure builds inside those veins, more fluid can leak into surrounding tissues. Then the lymph system has to clean up the excess. At first, the lymph system may keep up. Then over time, it gets overwhelmed. Another common reason is long sitting. When the calf is inactive, the lower leg pump is almost switched off. This is why swollen ankles are common during long car rides, flights, desk work, and evenings in front of the television. Another reason is medication. Some blood pressure medicines, especially certain calcium channel blockers, can cause ankle swelling. Anti-inflammatory pain relievers, steroids, hormones, and some other medications can also contribute. This does not mean you should stop a medication on your own. It means swelling is worth discussing, because sometimes the solution is adjusting the medication plan safely with your clinician. Salt can also matter. Salt pulls water with it. In some people, especially those with high blood pressure, kidney issues, or heart problems, a salty meal can make fluid retention worse. But salt is not the whole story. Many people blame salt while ignoring the fact that they sat still for 6 hours and never activated their calf pump. And then there is inflammation. This is where it gets more important after 60. Inflammation is not always bad. Acute inflammation is part of healing. If you cut your skin or fight an infection, inflammation helps protect and repair you. The problem is chronic low-grade inflammation, the quiet internal fire that can linger for years. It is associated with excess visceral fat, insulin resistance, poor sleep, inactivity, gum disease, chronic stress, and many age-related conditions. Inflamed tissues tend to hold fluid more easily. Blood vessels may become more reactive. Repair systems become less efficient. And the lymph system has more cleanup work to do. So swollen ankles can sometimes be a visible clue that your lower body drainage system is under strain. Not always dangerous, but not meaningless either. This is why the answer is not to panic, and it is not to ignore it. The answer is to observe the pattern. Does the swelling affect both ankles or mainly one? Is it worse at night and better in the morning? Does it happen after sitting? Does it improve with walking or elevation? Did it start after a new medication? Is there pain, redness, warmth, or skin breakdown? Are you also short of breath? These details matter because they tell a story. Swelling from simple fluid pooling often gets worse as the day goes on and improves with movement, elevation, and overnight rest. But swelling from a blood clot may be more one-sided, sudden, painful, or associated with warmth and redness. Swelling related to heart failure may come with breathlessness, fatigue, rapid weight gain, trouble lying flat, or waking up gasping. Swelling related to infection may come with redness, heat, fever, or tenderness. That is why the 5-minute habit is not a substitute for diagnosis. It is a supportive tool for the drainage side of the problem, and support can be powerful when used wisely. Now let's talk about the mistakes that keep ankles swollen. The first mistake is waiting until bedtime. By then, fluid may have been pooling for 12 hours. It is much easier to prevent a traffic jam than to clear one after the road is packed. The second mistake is sitting with the feet down for hours and assuming a walk tomorrow will fix it. Your lymph system responds best to frequent, gentle activation. A few minutes several times a day often beats one long session after hours of stillness. The third mistake is wearing socks that dig into the skin. A light sock mark can be normal, but a deep groove around the ankle can act like a little dam. It may restrict surface-level drainage and make the puffiness below it look worse. The fourth mistake is using tight compression without checking whether your circulation is healthy enough for it. Compression can be useful, but the wrong compression on the wrong person can cause problems. Proper fit matters. Medical conditions matter. The fifth mistake is thinking water pills are always the answer. Diuretics can be important for certain conditions, especially when the body truly has excess fluid volume. But if the main issue is poor leg pumping, vein valve problems, lymph congestion, or medication-related swelling, a water pill may not solve the underlying mechanics. That decision belongs with a clinician. And the final mistake is ignoring the skin. Swollen skin is stretched skin. Stretched skin can become dry, itchy, fragile, and easier to injure. Small cracks can allow bacteria in. For someone with diabetes, poor circulation, or immune problems, this becomes even more important. So keep the skin moisturized. Check the feet and ankles daily. Look between the toes. Notice changes early. Your skin is part of the warning system. Now here's the deeper truth. Your ankle is not the villain. Your ankle is the messenger. It is telling you that fluid is having trouble returning upward. Maybe because the calf pump is weak. Maybe because you are sitting too long. Maybe because the veins are struggling. Maybe because lymph flow is sluggish. Maybe because a medication is contributing. Maybe because something more serious needs attention. But the location of the swelling is not always the source of the problem. This is why the 5-minute habit works so well as a daily support practice. It does not pretend every cause is the same. It simply targets one of the most common missing ingredients in modern aging bodies: rhythmic lower leg movement combined with deep breathing and gravity assistance. You breathe to open the central pathway. You pump the ankles to activate the calf. You circle the joints to squeeze the tissues. You march to recruit larger muscles. You elevate to reduce the downward pull. That is not a gimmick. That is body mechanics. And after 60, body mechanics matter more than ever because the margin for inactivity gets smaller. A younger body may tolerate hours of sitting and bounce back quickly. An older body often needs more frequent reminders, more movement signals, more circulation signals, more drainage signals, more repair signals. So tonight, before you blame your shoes, look at the pattern. If both ankles are mildly puffy after a long day, and they improve with elevation, movement, and overnight rest, your lower body drainage system may be asking for help. Try the 5-minute routine. Do it gently, do it consistently, do not force pain, do not ignore warning signs, and do not let anyone tell you that swollen ankles are just a normal part of aging. They are common, but common does not mean meaningless. Your body is always communicating. Sometimes it whispers through fatigue. Sometimes it speaks through stiffness. Sometimes it shows you a ring around your sock at the end of the day. The question is whether you know how to listen. So remember this, swollen ankles after 60 are not always your heart. Sometimes they are your lymph system, your veins, your calf muscles, your posture, your medication, your salt balance, or your daily sitting habits all meeting at the lowest point of your body. And when you understand that, the solution becomes less frightening and more practical. Breathe deeply, pump the ankles, move the calves, elevate wisely, check the pattern, and get medical help when the swelling is sudden, painful, one-sided, red, hot, or comes with breathlessness, chest discomfort, faintness, or rapid weight gain. The goal is not to panic. The goal is to pay attention early. Because the earlier you support drainage, the less your ankles have to shout for help later. If your ankles swell more in the evening than in the morning, comment evening swelling. If one ankle swells more than the other, or if swelling comes with pain or shortness of breath, please do not wait. Get checked. And if this helped you understand what your ankles have been trying to tell you, like this video, subscribe, and share it with someone over 60 who keeps blaming their shoes when their body may actually be asking for better drainage.